de presse. We will start out today with remarks from the Chair of the Council of the Federation, Manitoba Premier Heather Stefanson, followed by remarks in French by the Premier of Quebec, François Legault. We will then take questions from the media. It is my pleasure to introduce the Premier of Manitoba, Heather Stefanson.
Good afternoon, everyone. High-quality healthcare services will always be a top priority for all premiers because it's a top priority for Canadians. The high-quality healthcare services that people need have to be there when they need them. Provinces and territories deliver healthcare, and we are accountable to our residents, to patients and families and healthcare workers every single day. Healthcare investments will always be the largest part of our overall budgets, but all of our healthcare systems are facing challenges right across our country, which is why all of us are already taking action, why we're making substantial additional investments to deliver improvements and better care for our people, to address the unique needs and circumstances in each of our provinces and our territories. The federal government has also an important role to play in this as a reliable funding partner committed to doing its part through adequate, stable, and predictable funding through the Canada Health Transfer. We started as a 50-50 funding partnership, and it continues to steadily decline over the years. The federal share of healthcare expenses is now down to just 22%. We need to address the declining federal share to restore and maintain it at 35% of the ever-rising costs. Not on a one-time basis. This new partnership has to be there reliably and consistently over the long term. More than 2 years have passed since premiers publicly outlined our proposal for a new funding partnership, but unfortunately, despite assurances, we have received no meaningful response from the federal government. There have been no federal proposals, no substantive meetings or dialogue, and no real progress. We need an urgent First Minister's meeting to discuss these critical issues. Now more than ever, Canadians expect their political leaders to get together for necessary and serious discussions to ensure the sustainability of the healthcare systems that they depend on across our country. All premiers are ready, willing, and able to sit down for serious discussions as soon as possible to pursue the true partnership that all Canadians urgently deserve. The premiers and the Prime Minister should meet early in the new year on these critical issues. Canadians shouldn't have to wait any longer for necessary action. The health and well-being of Canadians is one of the most important issues we are facing as a nation, and it's incumbent upon all of us as leaders across the country, including the Prime Minister, to sit down and address these very important issues. Thank you.
Thank you, Premier. Je passe maintenant la parole au Premier ministre du Québec, François Legault.
Oui, bonjour tout le monde. Je veux saluer les premiers ministres des provinces et territoires, en particulier Heather Stefanson, la première ministre du Manitoba, qui agit actuellement comme présidente du Conseil de la Fédération. C'est important que les provinces et les territoires soient unis et qu'on parle d'une voix forte pour défendre l'autonomie à laquelle on a droit. La santé, c'est la priorité à court terme en ce moment pour les Québécois, pour les Canadiens. Et dans toutes les provinces et territoires, le système de santé fait face à des enjeux importants et la pandémie est venue aggraver tout ça. Les provinces et territoires, on est responsable de donner accès à des soins de santé à nos citoyens et on est, et c'est important de le dire, imputable pour la qualité des soins. On travaille tous en ce moment pour innover, pour améliorer les services selon les besoins particuliers de chaque province, chaque territoire, et ces besoins-là sont différents d'un endroit à l'autre. Nos efforts touchent à plusieurs domaines entre autres le recrutement de personnel, la réduction du temps d'attente, les soins de longue durée, la santé mentale, la lutte contre les dépendances, l'accès aux soins de première ligne, les infrastructures et j'en passe. Au Québec, on s'est donné un plan complet pour apporter les changements nécessaires. C'est un virage majeur dans l'organisation des soins pour prendre en charge nos patients. Notre plan santé a 4 fondations, les ressources humaines, les technologies de l'information, les données et les infrastructures. Mais pour appliquer notre plan, on a besoin d'argent, on a besoin de la marge de manœuvre pour faire les choses à notre manière, en toute autonomie. C'est seulement comme ça qu'on va pouvoir réussir à améliorer en profondeur nos systèmes de santé selon les besoins de chacun. Je sais que c'est la même chose partout. Si le fédéral imposait une même vision partout, on n'arriverait pas à répondre aux besoins propres de chaque province et territoire. On a besoin de ressources suffisantes, prévisibles, pour relever les défis particuliers auxquels on fait face. Actuellement, le gouvernement fédéral finance 22% seulement des dépenses de santé. Je rappelle qu'actuellement, les contribuables, en tout cas c'est le cas au Québec, envoient 40% de leurs impôts et taxes à Ottawa. Donc, ce n'est pas normal qu'on n'ait pas une plus grande aide pour financer une dépense qui est la seule à augmenter à un rythme très important, plus important que n'importe quelle autre dépense. Notre demande est raisonnable, 35% de participation au lieu de 22%, plus une indexation de 6%. En ce moment, les provinces et territoires investissent déjà massivement en santé. On a besoin maintenant d'un vrai partenariat financier avec le gouvernement fédéral. Ça passe par le transfert canadien en matière de santé, sans condition. Si on veut régler les problèmes qu'on voit en ce moment, livrer les services auxquels la population a droit, c'est la seule solution. Le premier ministre Trudeau a dit qu'il voulait soutenir les provinces et territoires en augmentant de façon importante sa contribution au financement de la santé via le transfert canadien en matière de santé. Mais pourtant, ça fait 2 ans que le Conseil de la Fédération demande une rencontre sur ce sujet-là avec Justin Trudeau. Pour l'instant, on n'a eu aucune discussion concrète sur un nouvel accord de partenariat. Le fédéral n'a fait aucune proposition concrète. Les provinces et territoires méritent mieux que ça. Les Québécois et les Canadiens méritent mieux que ça. Donc, en terminant, c'est le temps pour un nouveau partenariat financier pour les années à venir. Les premiers ministres des provinces et territoires sont unanimes. Donc, on invite le premier ministre Trudeau à nous rencontrer rapidement en début d'année, de fixer une date et de le faire, évidemment, avant la préparation qui s'en vient du budget fédéral du printemps. C'est l'avenir de nos systèmes de santé qui sont en jeu. Merci.
Merci, Monsieur le Premier Ministre. We will now move on to questions. We will start with questions from reporters here in Winnipeg. Please come to the microphone to ask your question. Please state your name, your outlet, and direct your question to one premier. First question.
Hello, good afternoon. My question is for Premier Stephenson. This is Danielle from the Free Press. I'm wondering if there are any performance measures that the provinces would be willing to accept in exchange for increased funding to the Canada Health Transfer.
So I believe, Danielle, what you're talking about is accountability, and we are accountable to our residents within our jurisdictions right across the country when it comes to healthcare services. We face that every single day, and we'll continue to do that.
Our next question.
Hello all, Skylar Peters from Global Winnipeg and 680 CGOB. My question is also for Premier Stephenson. Just wondering if you've heard from any of your colleagues about some ideas that you could implement here in Manitoba. I know when we ask you about this, you often say that it's a problem that everyone is facing. So just wondering what you've heard in your meetings with your colleagues.
Yeah, certainly when it comes to human resource challenges, that's something that is not unique to Manitoba. It's something that we face right across our country and all the provinces and territories. And so we have regular discussions about those and how we can work collectively to improve that in all of our areas. So we'll continue to work together on that front. We are taking various measures here in Manitoba already, as you know, and we'll continue to take those measures moving forward.
Next question.
Premier Stephenson, Ian Fraze, CBC. This is in regards to the landfill, potential landfill search. I am seeking clarity in terms of who made the call to pause operations at the landfill. We were told first that, the operator was cooperative. We later heard that, it may have been stopped before then. At this point now, do you know who exactly stopped that?
The operator themselves stopped in the area. So we were not aware of that, though. We had reached out to them. They had indicated that they were supportive of this. So when we went out on the news conference yesterday, we were calling on them to pause any further development or our trucks coming into the landfill. And so we're working very cooperatively with the operator, the owner and operator of the landfill site, and we'll continue to work very closely with them.
Hi again, this is Danielle from the Free Press again for Premier Stephenson. So with respect to performance measures for accountability, is the position of the premiers then still that this funding needs to be transferred with no strings attached? Is there any willingness on behalf of premiers to accept increased or any types of performance measures targets from the federal government?
Thanks, Danielle. And again, I think it's an issue of accountability. We're accountable every day to people within our jurisdictions, and we'll continue to be accountable to them. And, we have unique situations in each of our provinces and territories right across the country. And so we know, what is needed within our areas. And we are accountable. I know I am accountable certainly every day, and our Minister of Health is every day when we go out and we make changes or we do things in our healthcare system. And that's the way it has to be. Healthcare is within the provincial, the delivery of healthcare services is within the provincial and territorial divisions. But, I will say that what we're calling for today is just a meeting to sit down with the Prime Minister to have the discussion about a fair and sustainable funding for the future of healthcare in our country.
Jeff Keel, CTV. I'm wondering if you don't get that meeting, what's the next steps for the premiers?
Well, I think it's important that we do get that meeting, Jeff, and we'll continue to call on the federal government and the Prime Minister to sit down. I think, Canadians expect us as elected officials across the country, both at the provincial and territorial level and the federal government, to sit down and have a discussion about one of the most important issues that we face in our country, which is the future of healthcare services and the delivery of those services to Canadians. And so I think they expect that that's reasonable. And I am very hopeful that the Prime Minister, again, as Premier Legault said earlier, it's important that we have that discussion early in the new year prior to them establishing what their budget is going to be moving forward. We want to ensure that the Canada Health Transfer, the increase to that Canada Health Transfer, is included in that budget.
Thank you. We will now move to take questions on the phone line. When called upon, I ask that you please state your name, your outlet, and direct your question to one premier. As a reminder, you may press *1 at any time to join the queue to ask your questions. You'll be limited to one question only. I would ask that you please make sure your phone is not on mute. You will not be audible until your name is called. Finally, a friendly reminder so the premiers can hear your question. If you are in the queue to ask a question, please only listen to the conference on the phone and not on the live stream, as there is a lag and you may miss your opportunity when called. Also, please ensure that you're not on speakerphone so that we can hear you clearly. Thank you. Today's first question is from Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. It's Premier Stephenson. I'm wondering why the provinces are continuing to cry poor when right now many are sitting on surplus. The federal government is increasing health sectors by 9% and federal government is in deep deficit.
So, this is within our provinces and territories, and certainly from Manitoba, healthcare is about 40% of our budget. And, so all we're really asking for here is just a fairness in all of this when it comes to the funding. And, we need to, in order to do that, we need to sit down at the table and have that discussion with the federal government. We have put a proposal on the table for the federal government and now, we have not received anything from them whatsoever at all, other than some discussions through the media. We shouldn't be having these very important discussions through the media. The discussions should be taking place around a table where we can decide what the future is of healthcare in our country.
Our next question is from Glenn McGregor, CTV.
Hi there, a question for Premier Ford. Absent the long-term funding issue, you have an immediate acute problem. The Children's Hospital here in Eastern Ontario is having to bring in the Red Cross to support caring for children with respiratory illness. Is there anything you're looking for from the federal government in the immediate term that could help with that? And also, would you consider bringing back certain mandates to help control the respiratory virus over Christmas?
Well, Glenn, great question. Thank you so much for that. First of all, I got to give a shout out to Alex Munter, the CEO. This gentleman thinks outside the box. He's coming up with creative ideas. We've increased funding there, but they're in a catchment area that covers a few million people. They're the only, if you want to say, game in town when it comes to pediatric care. Do we need more funding? Absolutely. We need the federal government to set a date early this year, coming up, sometime in January, and nothing should be more important to the Prime Minister than meeting with the 13 premiers. That's the bottom line. And then we can sit down and have a proper discussion. You can't keep running for 2 years away from sitting down with all the premiers. It's just not cutting it. The number one issue in this entire country, from coast to coast to coast, is healthcare. And we can't go it alone. As I'll speak for Ontario, we're increasing the funding at a rate of $5.6 billion this year, $5 billion before. We need the funding for long-term care. We need it for home care. We need it for mental health and addiction. We need it for HHR, health, human resources, infrastructure. We need a partner. And when you see backlog surgeries right across this province, when you see an increase in pediatric care at the hospitals and long-term care, mental health and addiction, everyone's struggling. Well, we need a funding partner. And right now, we're getting 22%. These provinces, all the provinces and territories, are paying 78%. It's unacceptable. Sit down, let's work collaboratively together, let's cooperate. We've done it before. I'll give credit to the federal government. When it came to EVs, electric vehicles, they were a great funding partner. When it came to funding electric arc furnaces at the Fasco and Algoma, they were a great partner. When it came to childcare, great partner. So let's sit down and cooperate. The people of this country expect it. It doesn't matter what political stripe you come from. They expect us to cooperate and work together. So I'm asking the Prime Minister, set a date. We will put aside our whole schedule, all 13 premiers, to show up to Ottawa and sit down and let's hammer out a deal. I've been Premier for this our second term, 4.5 years. I know Scott Moe as well. We've been sitting around this table. Nothing's happened. It's not that hard to sit down and have a conversation and hammer out a deal. That's what we're asking for.
Our next question is from Mélanie Marquis, La Presse.
Oui, bonjour. Ma question pour Monsieur Legault. J'espère que vous m'entendez. Monsieur Legault, votre ministre Fitzgibbon a dit qu'il fait l'objet d'une 6e enquête de la commissaire à l'éthique, a dit qu'il va y en avoir d'autres des enquêtes, ça ne me dérange même pas. qu'est-ce que ça dit sur la probité de M. Fitzgibbon? Avez-vous toujours confiance en lui? Puis, par ailleurs, j'ajoute une question parce qu'on a le droit à juste une. Comment ça se fait que vous n'êtes pas disponible pour une conférence de presse de fin de session comme il est d'usage de le faire? Merci.
Oui. Ben, écoutez, on a eu une courte session de 2 semaines. Essentiellement, ce qu'on a fait, c'est qu'on a aidé les Québécois à faire face à l'inflation, aux taux d'intérêt qui sont élevés. Pour ce qui est de M. Fitzgibbon, il y a une enquête de la commissaire à l'éthique et il va participer. Mais bon, je ne suis pas inquiet.
Our next question is from Lee Berthiaume, Canadian Press.
Yes, I'd like to go back to Premier Stephenson very quickly. With respect, you didn't answer the question as to why the federal government should be increasing its funding for this when many provinces are sitting on surpluses. Can you clearly explain to Canadians why this is an acceptable situation?
Look, we started, with a fair funding model between the federal government and the provinces and territories many decades ago, a 50-50 funding partnership. That has dwindled down to 22% from the federal government. We're just asking to sit back at the table and have the discussions. We have put our plan on the table, and I did mention earlier, about 40% of our budget and growing in Manitoba is for healthcare services. And as that grows, it takes away money for things like education and childcare and other areas, justice, social services, economic development opportunities. It takes away from all of those areas that are extremely important as well. And so that's why we need the federal government back at the table as a fair and equitable partner.
Premier Stephenson, can I come in on that one too? It's Premier Houston.
What's that?
Premier Houston?
Yeah, just.
Oh, sorry.
Yeah. Sorry. If I may, because I think what's really important here that we can't lose sight of is Canadians are proud of our public healthcare system. This is something that we take great pride in. That pressure is that system's under significant pressure everywhere across the country. I mean, I'm sure many of the outlets on here today probably ran a number of stories today about issues in healthcare in our various jurisdictions. So I think I heard a characterization of crying poor or whatever the case may be, but I think what we're asking for as premiers is for our partner on this, the federal government, to step up and do their part. It's expensive to run a healthcare system, but we have healthcare professionals across the country that are giving it their all every day under incredibly trying circumstances. We need to make investments to support them. We're willing to do it as provinces. We're doing it. We're carrying the ball. We're just asking the federal government to do their part and step up and be where they should be on funding. So I think any other discussion around our willingness to be held to account, of course we're willing to be held to account, because we want to deliver healthcare for Nova Scotians, for Canadians every single day. We want the federal government to stop looking away from this, stop walking past and whistling, and just stop and have a little chat with us and help us make sure that Canadians get the standard of care that they have a right to expect. That's what this is all about. Come and sit with us. Do your part. We're doing our part. Let's do our parts together, and Canadians will be better off for it. And that's what this is about.
Thank you. Our next question is from Valerie Bain, Radio Canada.
Bonjour, ma question est pour M. Legault. Monsieur Legault, est-ce qu'il n'y a pas moyen de trouver un compromis? Est-ce qu'il n'y a pas des priorités communes à partir desquelles vous pourriez travailler en tant que groupe pour en arriver à une solution? Alors qu'on sait que d'un côté, là, M. Trudeau, vous avez critiqué d'envoyer des chèques, il y avait une incohérence d'envoyer des chèques aux Québécois à cette période-ci, qui donne l'impression que la priorité, ce n'est pas nécessairement d'investir cet argent dans la santé.
D'abord, c'est important de dire, quand vous regardez les derniers budgets du gouvernement du Québec, il y a toujours une part très importante des nouveaux budgets qui vont à la santé. Maintenant, Il y a aussi d'autres problèmes, entre autres avec l'inflation et l'augmentation des taux d'intérêt. Je rappelle que les chèques qu'on envoie actuellement pour aider les Québécois, ce sont des montants non récurrents. Actuellement, on a vraiment un problème avec le financement récurrent des soins de santé. Puis, chaque province ou territoire a ses priorités. On est rendu à investir dans différents secteurs, que ce soit la santé mentale, que ce soit la première ligne, les soins à domicile. Chacun est rendu à une étape différente. Donc, c'est aux provinces de choisir les priorités. Et en plus, c'est un champ de compétences des provinces.
Our next question is from Teresa Katsuk, CBC North.
Thank you. My question is for Premier of Nunavut, PJ Herok. How much actual impact would an increase to the CHT have on Nunavut Mute, given that, my understanding, the CHT is based on population?
And healthcare affects all of us, and you're absolutely right. The impact to Nunavut isn't as great that other provinces feel, but with the reliance we do have and the remoteness that we see right across Nunavut, the reliance we have on our southern partners is enormous, and we're so thankful to the incredible partnership we do have with the premiers that rely so heavily on the healthcare systems we do have. So the significant importance still relies to every Nunavut who requires these specialized services that unfortunately we don't have the capacity to do right here in Nunavut. So the significance and the importance is there for us to support the unified voices that we're seeing right across the 13 premiers here.
Our next question is from Adam Harris, the New Brunswick Telegraph Journal.
Hi there, thank you. A question for New Brunswick Premier Blaine Higg. The Feds keep calling for an expansion in the sharing of key health indicators to build a world-class health data system in Canada. Do you have a problem with that in the same way it appears some of your colleagues do?
Thank you, Adam. I think that we're all interested in improved healthcare. Every one of us have the same needs and requirements for our citizens. And so we're all looking for ways to find better access, better sharing of technology. The disappointing thing that we're finding here as we're running into this is that we've been calling for a meeting now for over 2 years. We've said, can we sit down and have a discussion? The federal government seems to have every other priority other than the 13 premiers of every province in the country. And that's kind of where the rub is that we are totally aligned in having that meaningful discussion. And let's see where that takes us. So funding is obviously a key part of that. But then how do we find better healthcare right across our country? Because we're all interested in better outcomes for patients. And I want to learn from my colleagues across the country. So, I guess I'm really optimistic. If we could just have that date early January and the Prime Minister would agree to come to that meeting with all of us, who knows where that's going to end up. But getting together and having very meaningful discussion about an issue that affects every single one of us, every single province or territory, it's paramount. The hottest, most critical item in our entire country. It should warrant at least a face-to-face meeting on all the issues.
Our next question is from Carly Weeks, Globe and Mail.
This is for Premier Stephenson. It's clear that we have a crisis in hospitals, people dying in hallways, waiting hours for ambulance. Patients, parents, health professionals, organizations, I think what they want to know is why aren't the 13 of you coming out today with a list of things you're going to do to build up capacity tomorrow, to listen to what health professionals are saying, collect health data, and reorganize how health professionals work?
So thanks for that. Good question. And certainly I know our Minister of Health here locally has been out meeting with those in the front line, nurses, doctors, other healthcare professionals. We've been listening to them, and we have been acting based on what we've been hearing from them and making changes. You'll know, and locally we announced a $200 million investment in more healthcare professionals to bring more than 2,000 healthcare professionals into, our healthcare system here in Manitoba. We'll continue to work across the country with our colleagues to see what best practices are and learn from what's happening in other jurisdictions as well. We'll continue to have that dialogue. But the most important thing today is that we need to have the federal government come to the table and have that discussion with us, so that there is fair and equitable funding moving forward for all of our provinces and territories right across the country.
Our next question is from Jean Laroche, CBC Halifax.
Good afternoon, Premier. My question is directed towards Tim Houston, the Premier of Nova Scotia, but if any other Premier wants to weigh in, I'd be happy to hear what they have to say about this. I'm wondering, if we're talking, is there any discussion about the salaries and incentives the different provinces are offering health workers? You are trying to employ people from the same finite pool of health workers. And I wonder to what extent the differential in pay is favoring provinces that really don't have the fiscal ability to pay the higher salaries being offered by some provinces, because on the face of it, a bidding war between the provinces seems counterproductive to achieving what I heard Senior Legault say was needed, which is a stable, predictable workforce.
Thanks very much for that question, Jean. You're breaking up a little bit, but I understand that it's about compensation and maybe the competitiveness between each of us and our jurisdictions with one another about what we pay people. So you're absolutely right. I mean, look, we have incredible healthcare professionals in Nova Scotia for sure, and as we do across the country, and they're all delivering the best care they can under incredibly trying circumstances. And we know that compensation is important to them, but we also know there's other factors that are important to them too. Quality of life, being close to their family, where they grew up, all these types of things, right? So we do talk about certainly how we fix the issues in our healthcare system. Part of that is compensation. We are familiar with kind of what's going on across the country, but we also know that we have a lot more to offer as the individual premiers for our jurisdictions than just paying somebody more. We want to promote what's important to us about our province. So therefore, what will attract people to our province or keep them here where they grew up. So. But absolutely, I mean, the compensation is an important part of the discussion, but really, compensation is only part of the discussion. The real discussion is around the cost of running a healthcare system, and every premier here is running a healthcare system, and the costs are significant. And we've been carrying that load, a disproportionate share of the load on our own. And we're asking the federal government to step up and start to carry a little bit more of the share and carry a fair share. And we just want to sit down and have that discussion with them. So hopefully we can have that discussion with the Prime Minister in the new year about carrying a fair share, because we're certainly willing to carry ours. But compensation is part of it. There are other aspects to it for sure, but all of it costs money. And we just want our partner to be there with us when we're investing in our healthcare system. Thank you.
Heather, if I could add to that, it's Scott here in Saskatchewan.
Go ahead, Scott.
Yeah, I would entirely agree with Premier Houston on this. Compensation is part of how we retain the current human resources that we have across Canada, and most certainly it's an important part of it. But it's only part of how we are going to actually increase the number of people that are offering these services in healthcare center after healthcare center from coast to coast to coast. And so you would add to that compensation level in retaining our folks in our existing facilities, the ability that we have to recruit folks either into our education system, and I know here in Saskatchewan we're expanding the number of healthcare professional training seats that we have quite markedly, actually, as well as we have a very ambitious recruitment effort going on, and not only to those folks that might be in Saskatchewan and Canada that have healthcare training, and how we can work them through and streamline the regulatory approval bodies that we have, and we're working closely with those. But also our health minister was in the Philippines last week recruiting folks, and has extended a number of offers for folks to come work in our healthcare centers. And so, you know, we had the 4 priorities that Francois and Heather had mentioned at the opening. But ultimately, at the end of the day, we need more people offering these services and supporting those that are doing a yeoman's amount of work in our healthcare facilities today. And we need to ensure that we do have compensation levels that are there that retain those people in our facilities. But they need help, and they need help in extra hands coming in. I would just say on the accountability piece, we have in this nation a Canada Health Act that ensures that we're delivering a level of service across the country that is acceptable to Canadians, and we do that through a shared funding arrangement. Traditionally in Canada, a shared funding arrangement between the provinces and the federal government, and then healthcare is ultimately delivered by each of the provinces or the territories. And what we're seeing in the last number of years, and credit the federal government with the Safe Restart program, where they provided a little over $20 billion to the provinces. That was helpful as we found our way through a pandemic. But we have been requesting a meeting to sit down and have that conversation about how are we going to ensure that these healthcare services are sustainable into the future. And at 22% federal funding, 68%, provincial funding, 78%, pardon me, I have to do my math correctly, provincial funding. I would just put forward that isn't sustainable moving forward. And the healthcare cost sharing, investment sharing arrangement that was brought forward a number of decades ago was never anticipated to be with this small of a federal share. And so for this all to be sustainable, for our services to be sustainable into the future, we most certainly need to see an increase on the federal government's share. We've put forward that increase should be to 35%, to $28 billion increase. And for 2.5 years, we've been asking the federal government to sit down and, let's have these conversations about what the quantum is and ultimately what provinces can do to ensure that we're delivering a sustainable healthcare into the future. And provinces are already making this investment. I mentioned our Health Human Resource Action Plan. We put $60 million behind that. We've invested literally hundreds of millions of additional dollars into our healthcare system to address our surgical wait times. All provinces are making similar investments across the nation. And, herein lies the opportunity that I feel is being missed by our federal government, the opportunity to sit down with 13 premiers from coast to coast to coast in this nation to work on what is quite likely the #1 priority that Canadians have today. And that's to ensure that not only are we enhancing the people that are offering those services, increasing the number of people that are offering those services in our healthcare facilities today, but we're ensuring those services are going to be sustainable long into the future. And so it's an opportunity for the federal government to sit down with all of the provincial and territorial premiers collectively. We also represent every Canadian in our great nation, and we would hope that that's going to happen sooner rather than later. We've been asking for 2.5 years to no avail, and I would say that that's a disappointment for us, but we're confident that the federal government is going to take this opportunity. They've committed to increasing the CHT in the future, and so we want to sit down and discuss exactly what that quantum is. We've said it should be about $28 billion, bringing them back to a full funding partner of 35%.
Thank you. Our next question is from Robert Benzie, Toronto Star.
Hi, this is for Premier Ford. Isn't part of the impasse that Ottawa doesn't even agree on the accounting? You guys, premiers, all say it's 22% for federal government and 78% for the province and territories. But Ottawa says no. With the transfer of tax points, they actually fund closer to 1/3. So how can you get past that failure to even agree on the apples to apples comparison and then be asking for a meeting?
Yeah, thanks for that, Robert. Great question. But it goes back to sitting down and working cooperatively together, sitting across the table from each other. Communication is critical, and hash out the different problems that we may agree or disagree on. But Robert, we can't have this meeting by ourselves. we've been running around and, getting run around in circles for the last 4 years, 4.5 years. It's not that hard for the Prime Minister and his team to sit around the table when you have 13 premiers all wanting to have a meeting. We're just asking, let's have a meeting. We all feel that we're pretty close to making a deal. Let's sit down and hammer out a deal. That's the only way this is going to happen. But just keep, kicking the ball down the field month after month, year after year. It's not cutting it, and it's really hurting our healthcare system right across the province. We all have our needs. They're different needs. There's not one of us sitting here that's saying there shouldn't be accountability. There's accountability. There's going to be transparency, but we all have different needs at different levels across our country. So the first step is let's sit down and have the meeting, and we'll get everything on the table, both sides, and hopefully we can come up with a deal. But you can't do it by yourselves. So we need the federal government to come sit at the table sometime in January. Again, we'll clear our schedule. I know we're just as busy as the Prime Minister, but there's 13 of us. We'll clear our schedule and we'll make ourselves available. We'll show up in Ottawa and let's get a deal done. It's about as simple as that.
And if I may, Danielle Smith from Alberta, I think that the recognition that they are transferring tax points is with the level of the ask of the premiers. If the goal is to have a 50-50 funding partner, and with the transfer of tax points and the cash transfers, they believe that they're at 35%, then it seems to me that we're about 10 to 15 percentage points off. And if they come to our cash transfer suggestion of 35%, then we will get back to that ideal of them being a 50-50 funding partner. Through the Canada Health Act, they demonstrated that they do want to have cooperative federalism and they do want to be a partner on this issue. And they just haven't kept up with the incredible pressure that is happening in all of the provinces. I feel particularly that this is going to be very difficult in our smaller funding partners. The federal government has the fiscal capacity because they, as Premier Legault has said, collect 40% of the revenue. And in our provinces, when we can't keep up with that pressure of growth in this particular area, and even if we do, it ends up cannibalizing the amount that we're able to spend on all of the other important services that we provide to people. So I think I would just echo what the premiers are saying, is that we do need to go back to the original intention that we're equal funding partners.
Heather, if I can.
Please go ahead, Francois.
Yeah. Okay, I'm the accountant or one of the accountants here. First, it's true that the federal government transferred some tax points to the provinces. But at the end of the day, today, now, people, the taxpayers, they pay about 40% of their taxes to the federal government and 60% to provinces. And the only expense that is growing at 5, 6, 7% a year is healthcare because of the impact of aging population. So it doesn't make sense. It's not reasonable to see the federal government having only 22% of the financing while they receive 40% of revenues. And maybe another point also that was mentioned, I think a year or two ago, we've asked the conference board to make some forecast over 10, 20 years for the federal government and for provinces. And what you see on the long term is that even if the federal government paid a lot during the pandemic, it was non-recurrent money. So what we see in these forecasts is that long-term, the federal government will end up with surpluses and the provinces will increase their deficits because of the growing, the rate of the increase for healthcare. So for me, it's 1 + 1 = 2. It's clear at 22%, it doesn't make sense. If the federal government continue to finance only 22%, provinces will grow their deficits and the federal government will have surpluses and they will start investing in our jurisdictions. That's what they are doing right now.
Our next question is from Siobhan Morris, CTV News.
Hi, my question is for Premier Ford. Premier, you said that the healthcare system is suffering. How are you able to attribute that to this lack of balance in funding, and how exactly would more funding for Ottawa help solve that problem?
Well, thanks for that, Siobhan. It comes down to dollars and cents. You know, we're putting unprecedented amounts of money, all of us, out of our budgets, approximately, roughly about 40% around the country. And it's about long-term sustainable funding. It's no different, Siobhan, than running a business and reoccurring, reoccurring funding. As Francois always uses that language, and I love that language from Francois. It's not about here's one chunk of money. It's about how can we plan for proper health care for our backlog surgeries for the next 10, 15 years? How can we plan for the infrastructure of mental health and addiction for the next 10, 15 years, knowing we have a proper partner? We've been going out there for the last 4 years right now, basing our budgets on we're getting 22%. When it shouldn't be 22%, we're asking for 35%, $28 billion, and an increase of 6% every single year. It's not sustainable. There was an earlier question by one of the press, about surpluses. For Ontario, we had a small surplus, but I can assure you, with the healthcare spending and the money we're putting into healthcare, we're looking at a deficit next year, the following year, and the following year. We need some funding to make sure that when you see a backlog surgery, someone's not getting in there for any type of surgery. We need to beef up our HHR as well, Health Human Resources. We have to make sure that we're building medical universities that we are here in Ontario. We have to make sure that we're bringing people in from around the world, international nurses, to help us out. But not coming to the table, it just doesn't cut it. We need the federal government, in particular, we need the Prime Minister to sit down with us and broker a deal.
Our next question is from JP Tasker, CBC News.
Yeah, it's a question for Premier Ford. Johnny Duclos, the federal health minister, has already laid out the 5 strings that the feds want to see attached to new money, primary care, long-term care, virtual care, staffing. Those don't seem like overly onerous demands, and they dive with your priorities. Why can't you folks just accept those terms and everyone can move on? Why do you really need to sit down with the PM?
Well, JP, thanks for that. Again, you've heard it from all the premiers. We have no problem with accountability, transparency. We have accountability and transparency every single day, but we need the money and put it in different buckets. We need the flexibility to transfer from maybe one area to the other. All provinces aren't equal when it comes to what they need in their healthcare. One province out on the West Coast might need a little more on one thing. Ontario needs a little more on another thing. But if it comes down to transparency and accountability, we have no problem with that, but we need the flexibility. First of all, we need the funding, and then we need the flexibility to be able to move those funds around where they're needed. And as you just mentioned, it's pretty common around the country, no matter if it's long-term care, home care, infrastructure, mental health and addiction, and so on and so forth. So there's a certain standard that we have no problem working with the federal government and being collaborative. But again, we need the partner on the other side of the table to work with us.
Heather, if I could add to that, it's Scott again here from Saskatchewan. And this goes back to our healthcare ministers meeting that we had in Vancouver, I believe, or in British Columbia somewhere. The ministers met there. I think they had some good discussions about aligning some of the priorities that we have. And you make an excellent point, JP. priority items aren't that misaligned. In fact, they're quite aligned, be some variances across the nation. But at that particular meeting, and it was reported that, ministers have walked away from an offer that was made by Minister Duclos. There was no offer made by Minister Duclos. There was some discussion around aligning our priorities, which I think largely are aligned, save for some differences that we would have from coast to coast to coast in what is a very, very large nation. But the only offer that has been present thus far is the offer for over 2.5 years for premiers to invite the Prime Minister to a First Minister's meeting and to sit down about the quantum of investment and the opportunity that the federal government has to invest in the sustainability of our Canadian healthcare system moving forward. He's committed that he is going to increase that quantum, and we want to sit down and have the discussions about what precisely that looks like. That's the only offer that has been made. It's been a standing offer for 2.5 years on behalf of all 13 premiers, 3 territorial, 10 provincial premiers. Without response. And so that's the question I think that we are asking again today, and saying that we're going to be moving forward with that meeting with the Prime Minister and inviting him to attend as soon as possible, quite likely at some point very early in the new year. That's the question that ultimately needs an answer, and it needs an answer very quickly.
Our next question is from Mary Brooks, Island Social Trends.
Hi, my question is for Premier Stephenson. I'm just wondering if the premiers have discussed step-by-step funding coming in, like in lump sums from the federal government, as opportunities come up or challenges, such as the current pediatric situation. In other words, they would accept that money as on the basis of improving the healthcare worker situation, or buying new equipment, or improving their data systems, as opposed to butting heads all the time looking for a wholesale increase.
Well, one-off funding is not going to add to the sustainability of the long-term funding of healthcare in our country. And that's why we are calling on the federal government in the way of the Canada Health Transfer to increase those transfers to the provinces and territories. Now, the Prime Minister, as Scott Moe just said, the Prime Minister has agreed already to increase the Canada Health Transfer. We just want to be able to sit down at the table and have that discussion. What does that look like? We want to have that discussion at the table. I think Canadians expect us to sit down as elected officials across our country from all levels of government, to sit down and have that discussion to see what that looks like. That's all we're asking for.
Thank you. Our next question is from Campbell Clark, Globe and Mail.
Hello, can you hear me?
Yes.
Hi. So I'm a little bit confused because I understood from some premiers that they're not willing to negotiate data points or indicators with the federal government, and from others that they think that could be up for discussion. So let me ask you, as a Premier Stephenson, as position of the premiers, is there anything you're willing to negotiate in a discussion with the federal government other than the sum of increase in the CHC? And if so, can you tell me what that is?
I think the important thing of all of this is that in order to have a discussion, we need to sit down at a table and have that discussion. But that's all we're asking for. And if the Prime Minister wants to bring forward some ideas, again, we shouldn't be negotiating or discussing things through the media. We need to sit down and have that discussion with the Prime Minister in the way of a First Minister's meeting. And I'm not sure if there's anyone else that wants to add to that as well, but please jump in if you'd like to.
I would quickly, Heather, I just say to that, it's precisely the challenge that you raise. We can't negotiate with ourselves as 13 premiers as to what the federal share should be. We need the federal government at that table. The investments are already being made by all 13 provincial and subnational leaders that are on this call today. Ontario's making the investments, Quebec's making the investments, Saskatchewan, Alberta, Manitoba, BC. The provinces and territories are already making the investments largely in increasing the number of people that are coming to our front lines to support those that are already there. And so we can't negotiate with ourselves. That's why for 2.5 years, we've asked the Prime Minister to sit down with all 13 premiers and to negotiate what the future of healthcare looks like in this nation. We have we're very proud, I think Canadians are, of the publicly funded healthcare, the healthcare system that we have. It's under stress today, like many others around the world. The Prime Minister has said once the pandemic was over, we could have that discussion. He has said he wants to increase and will support provinces and territories with an increase to the Canada Health Transfer. So let's do that. Let's do it sooner rather than later. We've been asking for it for 2.5 years. We can't negotiate with the media. We can't negotiate with ourselves. We need the Prime Minister at that table, and it needs to happen on behalf of Canadians. And I would say it's an opportunity for the Prime Minister to participate in that meeting sooner rather than later.
Thank you. That's all the time we have for today. I want to thank all of the premiers and all media representatives for joining us. This concludes today's news conference. Thank you. Merci.
Thanks, everyone.
Thank you.
Thank you.